My name is Risa Wolf. I'm a pediatric endocrinologist and an associate professor of pediatrics at the Johns Hopkins School of Medicine. I am also the director of the Pediatric Diabetes Program. The focus of my clinical effort and research is pediatric diabetes and using innovative technologies to improve the care and outcomes for children living with diabetes. As a clinician scientist, it is the care of children and their families with diabetes that informs my research. My research includes clinical trials and quality improvement in diabetes care, technologies, complications, mental health, and nutrition. At Johns Hopkins, we are the first pediatric program to implement artificial intelligence, or AI-based diabetic retinopathy screening in the pediatric population. Diabetic retinopathy is a complication of diabetes that can lead to vision loss and blindness. Screening is important for early detection of diabetic retinopathy, yet it is often challenging for patients to complete this additional screening, as it generally requires a visit to an eye doctor separate from the diabetes team. In order to improve access to screening, we implemented this novel technology in our clinics in 2018, demonstrating its safety in children while also significantly improving screening rates. We then conducted the ACCESS trials, which stands for AI for Children's Diabetic Eye Exams, and in a randomized controlled trial demonstrated that offering AI for diabetic retinopathy screening at the point of care can help patients get their screening done and close clinical care gaps. We also recognize from these early studies that there were disparities in screening completion for diabetic retinopathy, particularly in our underserved and minority populations. In our ACCESS 2 trial, we demonstrated that offering AI at the point of care can improve access to screening and further health equity, closing those disparity gaps. In another technology area, we know that there are benefits to glycemic control with the use of continuous glucose monitors, insulin pumps, and automated insulin delivery systems. In order to improve use of these systems, we have deployed a diabetes navigator as a technology liaison for our patients across the lifespan, pediatrics, adolescents, and adults, to determine if this role can help our patients start to use technologies or better use the technologies that they already have. As the director of the Pediatric Diabetes Center, we are always striving to improve our clinical care and outcomes. Another way we do this is through quality improvement initiatives, and we are involved in the Type 1 Diabetes Exchange Quality Improvement Consortium, which is a collaborative for sharing QI initiatives, experience, and results, and really challenges us as a program to always strive to do better. Since joining this collaborative, we have implemented quality improvement programs to improve mental health screening and diabetes care, improve nutrition counseling, and the transition process for patients moving to adult diabetes care. In general, as a program, we are also very involved in the general diabetes community, partnering with organizations such as Breakthrough T1D and the American Diabetes Association in community events and partnerships. A highlight of this collaboration is Camp Charm City Diabetes Camp, which we've co-founded in 2019 in collaboration with the American Diabetes Association, with the mission of providing an accessible, affordable, and inclusive day camp option for children living with diabetes. Camp provides a fun day camp experience with the support of a full medical team so kids with diabetes can be safe while having fun. All of us who participate at camp would tell you that this is truly the highlight of our year, and we look forward to it every summer. Thank you for listening, and thank you to my patients and colleagues who make all of this possible.